Hi, I'm Brianna. I'm going to take a couple x-rays of you today. Can I verify your name and date of birth? What's your name?
Jared Brewer.
What's your date of birth?
12/10/93.
Any chance of pregnancy?
No.
Okay. Have you put on a robe? And if you have any jewelry or socks or shoes, please remove them.
Sounds good.
Okay. You can lay down here. So for my first exam of the hip, it's going to be an AP. Oh, you can't see. My first exam of the hip is going to be an AP hip. I'm going to be using a 10x12 cassette at a 40-inch SID. So I'm going to slip this under your hip here. Good. Let me do this hip actually because you can't really see it. So your IR for this should be at the level of, it should actually be centered to your central ray, and your central ray should be perpendicular to the femoral neck using the localization method. So the localization method to find the femoral neck is, if you find the ACES, it should be about right here. If you were to draw a line from the ACES to the pubic symphysis, which you can find by localizing the greater trochanter. So if you were to draw a line for the ACES to the pubic symphysis, from the midpoint of that line, if you go down 2 to 2.5 inches, should be the femoral neck. So the femoral neck should be about here. So I'm gonna bring this down a smidge. Okay. And your central ray should be centered to the femoral neck as well. It won't stay. So for this exam, we should also make sure that there is no rotation by checking the ACES to the distance from the ACES to the tabletop. That should feels centered. The legs should be medially rotated 15 to 20 degrees, and this places the femoral necks parallel to the IR. Our collimation, we're going to take up the full 10x12 of our cassette. We will shield our patient. We have marked our patient, and for this exam, because it includes the hip, we are going to suspend the respiration. So please hold your breath, and boop, that is the AP hip exam. Next is our cross table lateral hip. So you can see. Scooch up just a little bit.
Okay.
Like that way. Just so you can see better. It's really close. Oh. Alright, for this exam, we are also going to be using a 10x12 cassette with a 40-inch SID. The only difference is that our tube is going to be at an angle and it's going to be down closer to the table. So you would have to measure that. The top of your IR for this exam should be placed in the soft tissue just above the iliac crest. And if you had a really small patient, you would want to put like a towel or a sheet folded or something under their hip to place the greater trochanter centered to the IR. For this one, I think we'll be okay. And our IR needs to be at an angle that is parallel to the femoral neck. So we are going to rotate the affected limb inward 15 to 20 degrees. And the unaffected limb, we're going to draw up and out of the way and use a stirrup or something, or I'm going to have him hold it. We'd use a marker. We will shield our patient, and your central ray for this exam is going to be midline of the thigh, and it's going to be perpendicular to the femoral neck. the long axis of the femoral neck. So it should be Again, using that localization method. Should be about right here. If the femoral neck is about here, we're centered to that, and then it should be centered to midline of the thigh. So we've got our top of IR in place, parallel to the femoral neck, and the greater trochanter is in center of the IR. Our collimation, we would use the whole 10 by 12 of the cassette. And our book says that if we are using a grid, it should be vertical, but the ledge strips in the grid should be horizontal. So we've got our marker, we are shielded, our CR is in place, and we're gonna suspend respirations. Please hold your breath. Boop. Okay, and that is our cross table lateral hip. You can relax.